Assalamu alaikum wa rahmatullah. For this class session, community health nursing, epidemiology of health and illness. The learning objective for this session, so we'll define the following terms: epidemiology, epidemic, pan-epidemic, and endemic. So discuss the importance of epidemiology and explain the host, agent, and environment model, discuss the natural history of diseases and level of their prevention. List the major sources of epidemiological information, then distinguish between incidence and the prevalence in the health and illness status, apply the epidemiology formula to calculate the following incidence or indicators: the crude mortality rate, the crude birth rate, the case fertility rate, and age-specific mortality rate, general fertility rate, and maternal and mortality rate, infant mortality rate, and prenatal mortality rate. The learning objective describe also the chain of causation of disease, explanation of the role of web of causation and mixture of in identifying the disease and injury occurrence, define immunity and compare passive immunity and active immunity, cross immunity, and herd immunity. Differentiate between the epidemiology research and the research process. So, in the definition of epidemiology, it is coming from the prefix epi, which is upon, and demos, which is people. Ology, which is the science and knowledge. So epidemiology, it is the science which deal with the people, and also bringing between biomedical, social, and behavioral science. So it is a study of the disease behavior and progress. So epidemiology is concerned with distribution and determinants of health and diseases, morbidity, injury, disability, and mortality in the population. So this is defined by Ferris and Sellers in 2009. Definition of epidemic. Epidemic refers to the disease occurrence that clearly exceed the normal or expected frequency in a community or a region. So when a disease is exceeding it is normal occurrence in a region or in a community, it is considered as being epidemic in that community. Pandemic, when an epidemic disease is worldwide, so it is not only in a certain community, it is not only in a certain region, it will go widely to the other country. So worldwide distribution, it is called pandemic. So when it is distributed from country to country, like COVID-19, and it started, let us say, as its beginning in Wuhan, and then spread it to China, then spread it from China to all other countries. So it is pandemic disease. When it is started there, it was epidemic in Wuhan. Then, when it is started to be outside, it has become pandemic. Endemic, the continuation presence of disease So epidemic, it is present in a certain community or a location. Endemic, it is continuation of presence of that disease or infectious agent in a given geographical location. So when a disease is located for a long period of time in a certain country or a community, like malaria in certain country, when it is progressed for a long period of time, it is considered as endemic in that disease. Malaria, it was endemic previously in 70s, but it is eradicated now in Oman. Importance of epidemiology, it is to investigate the nature and extent of health-related phenomena in the community. So it is study the health-related phenomena in the community and identifying the priorities for the healthcare and the direction of the healthcare goals toward a certain problems. The study to study the natural history and prognosis of health-related problem. So in epidemiology, we are studying the natural history and the progression of the problem, and it is what is going around it. Because up till now, COVID-19, it started in 2019, and we are now in 2000 toward the end of 2021, and still they are studying the progress of the disease and the factors that might lead to that disease. To identify the causes and risk factors, and to recommend and assist in application of and evaluation of best intervention for prevention and therapeutic measurement. So to find out the proper measures for prevention and proper measure for treatment of that disease. To provide foundation for a public policies in order to avoid that, to provide a frame of reference for investigation and improving clinical practice and any setting. The host and agent and environmental model. The host is the susceptible human or animal who harbors and nourish a disease-causing agent. So when the causing agent is harbored in a person or an animal, we call he a host. The agent, which is a factor that causes or contributes to health problem or condition. The factor that can cause a health problems or contribute to the health problem. The environment, all the external factors surrounding the host that might influence the vulnerability and resistance of that condition, or this might interfere with the spread of the infection. Theories of causality of health and illness, in relationship between the cause and its effect, the chain of causation, how the disease behave, how the organism behave, and how it is transmitted and cause the infection. Causation in non-infectious disease, environmental exposure, and potential health outcome, which is the 9 elements. Multiple causation, diverse epidemiological model, also called the web of causation. So the epidemiological triads, we have to have in order to get the illness or the state, there is also a host, and there is an agent or positive agent, and environmental factor that might help in development of the disease. So host is there, the infected person or animals, or the one who is having the source of infection, the infectious agent, and also with its characteristic and the ability to cause disease, the environmental factor that might hinder or might help in the transmission of the disease and causing of illness. So all of those aspects, the three things are sharing in the transmission or prevention of the disease, as if we are cutting this chain for that trend. So the chain of causation in the environment, a human with malaria. So he is considered as the reservoir for, or the host for the malaria. The anaphylaxis mosquito will bite that infected person. So there will be a portal of exit in this case. So the mosquito will get the microorganism. Then the mosquito, it is the mode of transmission. It will transmit the agent to other person. Protozoa multiplying in the mosquito. So there are some changes in the stages of life of that protozoa inside, or the malaria parasite inside the mosquito, and it has to be happened. If we cut this chain, if there is no mosquito, in this case, no change in the malaria parasite will happen, and it will not be transmitted. So it cannot be transmitted directly from person to person about this disease. Anaphylaxis mosquito will go and bite another human being. So it is a portal of entry. So it will introduce the microorganism in the body of the new host, new human being. So the human become, the other person will become infected. So a new host will be there. So a new host will be there for infection. And this, if we did not prevent, if we did not cut this chain, there will be continuation of transmission of the disease, and number of people who will get the disease are more. If we are taking COVID-19, a person is having the virus it can be transmitted through the direct or through the droplets. So how we can prevent it? If we are keeping distance between us and other, if we are keeping mask, if we are washing our hand, this will minimize the transmission of infection. If we are not using any of those measures, in this case the transmission, it will be very high. Crowdedness will lead to more transmission of the disease. So it depends upon the mode of transmission, it depends upon the way of transmission of the disease. So in epidemiology, we are studying the behavior of the disease and the organism, and the causation, and how the chain for causation in order to cut it. The immunity, it is the host ability to resist a particular infectious disease causing agent. So if I am having immunity against a certain disease, if I got the vaccine for measles, in this case I will have immunity against this disease. So if the organism enter my body, the antibody, which is there in my body, it will resist the multiplication of that organism inside my body. There is type of immunity, and you got this type of immunity with microbiology. The passive immunity, which is short-term, acquired, natural, or artificial, which is either through antibodies, if we are giving antibodies, which is the artificial one, or through the milk from mother for infant. Active immunity, which is, it will last a longer time, sometimes it is lifelong, it is acquired naturally or artificially. Naturally, if we are getting the disease or getting the microorganism, sometimes we are not getting the disease, but we might get the microorganism from the environment, but the level of exposure, it will be less. So we are developing, instead of developing the disease, we will develop our immune system will resist this and will develop antibodies. Or it might be, it can happen with taking vaccination. So the common infectious disease, we are giving people vaccination for them in order to avoid exposure to those diseases. A cross immunity, which is immunity to one agent, providing immunity to another related agent. So in this case, some of the vaccine or some of the disease, if you got it, it might also lead to formation of antibodies. That also it might help in the prevention of other diseases. The herd immunity, which is immunity level present in the population or a group, or now what we call it the community or community immunity of the community of مناعة القطيع يعني يسموها. Risk. It is the probability that a disease or unfavorable health condition will develop. Directly influenced by biology, environment, lifestyle, system of the healthcare. So the system, if there is any, if the healthcare system is having some problems, also this might increase the possibility of infectious disease. If we have an environmental factors or environmental pollution or breakdown in the environment, also it will lead biological spread of microorganism, and so there are many factors there. Risk factor, negative influence also. Epidemiologists studying population at risk, so they are collecting collection of people among whom a health problem has the possibility of developing because of certain influencing factor are present or absent, or because there are modifiable risk factors. So the epidemiologists will study the population at risk. Population at risk, those population who are having some factor that it can be modifiable factors, or some of the factors might not. So there are some modifiable and some non-modifiable factor that might lead or that might interfere or raise the possibility of transmission of a disease. Measurement of relative risk ratio. The measurement of relative risk ratio, it is the incidence rate in exposed group, incidence rate in unexpected group, unexposed group. So it is the risk factor or incidence of having a disease in still not exposed group to that disease. The natural history of disease or health condition, we are studying the susceptibility stage. So the susceptibility stage, the disease is not present and individual have not been exposed to. So here they are susceptible because still they are not having the disease. Host and environmental factor could very likely influence people susceptibility to causative agent and lead to development of the disease. So the host and environment, the presence of the host, some factor in the environment, and it might be helpful for the person to avoid the disease, or it might increase the susceptibility of the person to get that disease. The natural also this history of the disease and condition, we have the subclinical disease. In subclinical disease stage, here when the individual had been exposed to a disease but are still, there is no signs and symptom. So he is exposed to the disease, he is having the organism, but still the signs and symptom not apparent on the client. So it is the delayed stage or during the incubation period. So incubation period is the duration period which the organism multiply to sufficient number to produce a host reaction and the clinical symptom. So the organism might enter the body and it might took, as example, 1 week to multiply and to produce a signs and symptom. So if this is common in most of the people who are getting infection with this disease, we say that the incubation period for this disease is 7 days. So it is different from organism to organism and disease to disease. Some of the diseases will take a very long time to have the signs and symptoms. The induction period, which is condition caused by non-infectious agents, the time from exposure to onset of symptom, known as induction period or latency period. So still that the signs and symptoms are not appearing. The clinical disease stage, in the clinical disease stage, which is the third stage, the signs and symptoms here of the disease will start to develop and to appear on the client who is having that disease. Then we have the fourth stage, which is the resolution stage, that the disease or the health condition causes a sufficient anatomical or functional changes to produce and recognizable signs and symptoms. So it is the resolution stage. So those are the stages. Stage susceptibility. If the person is susceptible to a disease, then he will expose to the microorganism. When after that, he will be, after exposure, after the microorganism enter his body, he will be in the subclinical stage. So the signs and symptoms are not there. So in this case, we have to go to primary prevention. The primary prevention for the stage 1 is to identify those who are susceptible and to increase their immunity, or to increase the immunity of the community by the immunization of the immunity. or special consideration to a certain group. In the subclinical stage, we have to find out those who are having the microorganisms, those who are in the subclinical state. How we can? By screening tests. So we have to do screening tests for those people who are having no signs and symptoms. In the clinical disease stage, here we have to start early diagnosis and treatment. We have to give a treatment for them. In the resolution stage, we have either it will lead to disability or death or recovery. So, which is the tertiary prevention. Tertiary prevention, we have to prevent the complication of the disease. So here we have to treat the disease, give the treatment, and we have to prevent the complication of the disease. If complication happen, we have to deal with the complication to prevent the further effect of that complication on the client and to treat that case and to prevent death or disability. The level of prevention, this to apply to level of prevention during the 4 stages of natural history of the disease. The goal using the 3 level of prevention, negative health condition are avoided to promptly diagnose and treat and the first possible protection for restoration. So as we mentioned before. So the primary prevention, so the health promotion and by health promotion of and education, like in nutrition, also counseling for those who are having chronic illness in order to prevent like diabetes, in order because they are having might have low immunity. Pregnant women also might have a low immunity, so we have to give them health education to avoid, and we have to give them more support to avoid the transmission because they are more exposed. Smoker also, they are exposed to cancer. So we have to identify those who are at risk, give health education for all and for those at risk in order to avoid the problem. Health protection, improving the housing and sanitation and waterborne disease, avoiding waterborne disease, immunization for them, and removal for environmental hazard and the prevention of accident. So the secondary prevention, it is by early diagnosis, by screening tests for them, then prompt treatment and immediate treatment, and in order to stop the progression of the disease and prevent the associated disability. The tertiary prevention, it is rehabilitation after getting the disease, reduce the extent and severity of the health problem and to minimize the disability, restore also the function of the body and minimize the effect of the disease on the body and the ability of the person to perform his work. The health promotion and education training of employees and homeless population, group treatment and rehabilitation, adolescent drug users. So those are some of the education for them. Then the health protection, health services and immunization as needed, and this is from primary education. Okay. The source of epidemiological information we are getting the epidemiological information through vital statistic, which refer to the information gathered from the ongoing registration of birth and death, adoption, divorce and marriage, census data from population census which is taking every 10 years in most of the community, in most of the country. Reportable disease, report of the disease. So for the infectious disease, it has to be reported directly. Some of the diseases we have to report it directly to the Ministry of Health. Then the Ministry of Health also will report it to World Health Organization in order to study the spread of disease and to prevent the spread of disease. Disease registration and registration for every cases, especially infectious disease. Source of epidemiological information, again also the environmental monitoring the health hazard found in the environment, the pesticides, industrial waste also, the radioactive or nuclear material in the community, chemical additive or additive in food and their effect in the body, and medical drugs are the list of the pollutant. Also, National Center for Health Statistic Health surveys. There are national center in each country for doing health surveys. Informational observational studies is done. Scientific studies carefully designed for scientific studies in order to study the behavior of the diseases. Distinguish between incidence and prevalence in health and illness status. The incidence refer to all new cases of the disease, all new cases of disease or health condition appearing during a given time. So the prevalence is the study of all new cases in the community within a given time. So incidence rate, it is calculated by number of present or a person developing the disease over the total number of persons at risk per unit of time during a period of time. The prevalence, it's referred to all the people with the particular health condition existing in a given population at a given point of time. So it is the total number of people who are having that existed disease. So the prevalence rate, it is number of persons with the characteristic or that disease over the number of population. So the number of cases over the number of population. It will give us the prevalence rate of the disease. It might be 10,000 or percentage can be. But the prevalence, it is number of persons developing the disease at a period of time over the number of people at risk at the same time. We have to apply the epidemiological formulas to calculate the following incidence: the crude mortality rate, the crude birth rate, case fatality rate, according to the cases, age-specific mortality rate, general fertility rate, maternal mortality rate, and infant mortality rate, prenatal mortality rate. So, during which of the following stages would the community health nurse first expect to see signs of the disease through laboratory testing? Is it during the susceptibility stage or the subclinical disease stage, the clinical disease stage, or resolution stage? You can find the answer. Did you find the answer? Which one is it? So it is the clinical disease stage. So during the clinical disease stage, you can find out the infectious agent. Web of causation, we have depend upon. So if we, for the road traffic accident, we have the road, condition of the service of the road, construction of the road, also the speed limitation, the traffic patterns on the road. So all of these are considered to be either preventive if they are constructed in the proper way, so it will minimize the number of automobile crashes. If it is negatively affected, if it's not constructed in a proper way, in this case it will lead to more automobile crashes. Weather and environment. So there are factors within the road construction and service, the speed limitation, and our if we are obeying the traffic pattern and the speed limitation, then the weather and environment, terrains and visibility. So also if visibility is not there, if rain is there, snow is there, all will affect our or the exposure to the motor vehicle or engine. Then the vehicle itself. In the vehicle itself, we have the function of the brakes, function of the engine, functioning of the windshield wiper, also function of the headlight. All of these also, if it has some improper function, it will lead to more accident. If we are checking it regularly and we are maintaining it, in this case, it will prevent accident. The driver, then we will come to the driver. So in road traffic accident, we have the road, the weather and environment, the vehicle, and the driver. In the driver, knowledge of vehicle. Did he know the capability of his vehicle or not? The driving speed. Is he going with the limitation of the speed or not? Driving experience. How to manage if something happened as emergency with the car or with other drivers. Driver health. Driver health condition. Also, it will affect it. Sobriety and attitude, alertness. All of those things, all of those characteristics on the driver, it will affect either some of the drivers, they are risk taker. So they know the limitation, but they want to try to close the meter of the car, so they might have an accident. So they might not having a good experience. They are a new driver, so they are more prone to accident. They might be more prone to accident than other, or he might feel overconfident. A research process for an epidemiological study. In research, we have to identify the problem, review the literature, and design the study, collect the data, analyze the finding, developing and consulting and application, conclusion and application, sorry. So we have to develop, reach to a conclusion and to apply it. Disseminate the finding and to others. So those are the steps of research, which you study it also in the course of research. So we will not go through them. Thank you.